Hello, this is Emilia Banse, psychiatric nurse practitioner. And in this talk, we're going to be discussing bipolar disorder. Just like any other psychiatric condition, bipolar disorder tends to be on a spectrum as far as the severity and the gravity of the disease. So sometimes you have a full-blown bipolar person and then somebody who's got more of an unstable mood type of a disorder, which falls under that same category. But in order to be diagnosed with bipolar, you must have had at least one manic or one hypomanic episode. And these episodes are typically characterized by an expansive, euphoric mood, or it can be also a very irritable and a very angry and explosive mood. There's almost always a significant increase of energy, a decreased need for sleep. So we're not talking about not sleeping for days and feeling tired and sluggish and not being able to function. We're talking about not sleeping for 3, 4, 5, 6, 7 days and still being full of energy and engaging in multiple activities and starting different projects, often not finishing them, difficulty with concentration and focus, increased impulsive behaviors, or behaviors that are harmful to oneself, like becoming sexually promiscuous. And usually with bipolar, the classical bipolar disorder, that manic state does present with some impairment in functioning. So the person is not able to really function, and there's sometimes a disconnect from reality when we're in that state. That's not the case for a hypomanic episode, and that's typical for bipolar type 2 is what we call it. It's a hypomanic episode, so also an increased elevated mood, energy, perhaps a decreased need for sleep, but not to the same extent as with bipolar. And there's usually no impairment. So the person's able to function, often very productive and happy, but often the negative side of this is there's always a depressive episode that follows at some point. Bipolar is the most underdiagnosed and the most overdiagnosed condition. So I often see clients who have been diagnosed with bipolar, and after really careful examination, knowing them for a while, they really are not. And then you have people who come to you with something other than bipolar disorder, and then with careful examination, it becomes very clear that they're really struggling with bipolar disorder because typical treatment for depression or anxiety that they sought has not been working. And so there's usually something else underlying, and the person's kind of aware of it usually. And a good clinician should pick up on that as well. So that's wraps up briefly, kind of explains to you what bipolar disorder looks like. But there are many other variables, of course, to consider.